Hi, everybody. My name's Andrew. I'm a respiratory therapist here at Valley Sleep Center. I've been here for about a little over 7 years, almost 8 years at this point. Um, my primary role is working with patients that are struggling with their CPAP machines. Just of course, as a respiratory therapist and clinical sleep educator, working on any variants of helping your sleep is generally my goal. Um, Sleep aids are obviously something that people have taken. Most people have taken in their life, whether it be melatonin or some people have taken Ambiens, and some people have taken the over the counter like Unisoms and or even like Benadryl and stuff like that. So some people get some really good positive effects. Other people might need some other pick-me-ups or benefits from other directions. So I'm going to go through a handful of different sleep supplements that are natural, that are available on the market that you can buy without a prescription and just obtain. So without further ado, I will get this slideshow going. And here we go. All right, so some natural sleep supplements. Let's get this ball rolling. So obviously natural sleep supplements help you get some sleep. All right. Getting the appropriate and good amount of sleep is incredibly important for your health. Obviously sleep helps with your body and brain function. It's super important for learning, memory, decision-making, cognitive focus. For people who are artists and stuff, it's great for creativity. Insufficient sleep, it's a disaster for most people. I mean, there's some significant heart issues, diabetes, obesity, lots of risks of health issues, and it's been linked to even Alzheimer's, dementia, Parkinson's disease, different things that are affecting your cognitive focus. Despite this, sleep quality and quantity are low. I mean, we live in a sleep-deprived society, whether it be something we do to ourselves or with sleep disorders or sleep apnea or insomnia or whatever the case may be. And it's very common for more and more people to be experiencing poor sleep. Now, good sleep often starts with good sleep practices, such as, having good set bedtime, getting calm and cool before bed, and having a good, lead into falling asleep, nice, cool environment. But some people need pick-me-ups, something to help them get some sleep. And there's some natural sleep promoting supplements that are available on the market. Melatonin, this is probably the most commonly used over-the-counter natural sleep aid. Melatonin is a hormone that is naturally produced in our brain, okay? The hormone is affected by the time of day. Melatonin naturally rises in the evening and falls in the mornings. Kind of a good way of, putting it, the last hour before bed, you can kind of start to feel groggy, you feel tired, your body's production of melatonin. And then while you're sleeping, melatonin is being released significantly into the body to keep you sleeping. Now, melatonin can be taken over the counter as a sleep aid, and generally the max doses that we would recommend is somewhere around 10 milligrams. Anything more than that doesn't really necessarily help, and it can actually cause your body's ability to stop producing melatonin. Although there's really no significant side effects to melatonin, you just don't want your body to forget how to do it. And several studies report melatonin improves, the daytime sleep quality for people who are shift workers when they work night shift and they sleep during the day. The melatonin can improve sleep quality in individuals with sleep disorders such as sleep apnea or insomnia. And melatonin does appear to reduce the time people need to fall asleep and increase the total amount of sleep time in the night. Valerian root. This is an herb. It's common in Asia and Europe. It's used to commonly treat anxiety, depression. It's been used in menopause, and I mean, I didn't really look up the link behind it, but that's what I read. Sure, why not? Valerian root is also one of the most commonly used sleep promoting herbal supplements in the United States and Europe. It does show that menopausal and postmenopausal women have had increased sleep quality, and their sleep disorder symptoms improve after taking valerian root. The literature shows that between 300 and 900 milligrams of valerian root can be taken before bedtime to improve the sleep, self-related sleep quality. And short-term intake of valerian root appears to have very little side effects for adults and with minors as well. Calmsforte. This is a supplement that a lot of times that I like to talk to my patients about. It's something that you can take, and it's just has chamomile and passion flora, has some natural herbs inside of it, and it's been used to help fight sleeplessness, obviously calming the nervous system for irritability. Passion flower has been seen to be able to treat anxiety and calm and restlessness. The dosages is somewhere around 1 to 2 caplets of tablets a night with water, of course, 3 times daily for relaxant, and for sleeplessness, 1 to 3 hour and a half, half hour to an hour before bed. Medicines will obviously work differently for every patient. So there's a lot of times that reason that we're giving a lot of these different options is because you might end up taking melatonin and be like, okay, this isn't working, and now where's another one? Or you might be a person that said, I've taken this in the past, now I need some more options. I would like to look at the door open for different variables. A lot of times with Calmsforte, people experience fast relief. It works quickly. I find it on Amazon. It's not too terribly expensive. Magnesium. Magnesium is a mineral that we can be taking. There's calcium, magnesium, zinc supplements and such that you can be taking. What magnesium does is it helps. It's important for brain function and heart health. Okay, it helps quiet the mind, making it easier to fall asleep. Melatonin is also shown in studies to help regulate the production of natural melatonin. So you could be taking magnesium, and then on top of doing the magnesium, your melatonin production that your brain is naturally producing is being regulated and increased. It's shown to relax muscles. Magnesium in combination of melatonin and vitamin D was shown effective in treating insomnia, regardless of the reason why you might have insomnia. Magnesium helps increase also something that's called gamma aminobutyric acid, or GABA. It's a brain messenger that helps with calming effects in the brain. Studies show that insufficient levels of magnesium in your body has been linked to troubled sleep and insomnia. Increasing magnesium intake by a supplement, like I said, the calcium, magnesium, zinc is a pretty common one that you can find over the counter. Plus, on top of it, all three of those micronutrients are very helpful for the body. I talk about zinc a lot with my patients for their immune system health. Lavender. Lavender is a plant, of course, it's a flower. It's purple flower. A lot of times people can use it. They have lavender teas. They have the lavender essential oils, and it's the fragrance has been shown to help enhance sleep quality. Simply smelling lavender, whether you put it on your chest or whether you put it, you smell it on some sort of on your clothes or something, it shows that helps increase the sleep quality. And it's been helpful for younger people, such as females and younger adults with mild insomnia. It is an aromatherapy, so I imagine you could probably set up one of those aromatherapy systems and it emits it into the bedroom, which also would help too. And that's not necessarily recommended to ingest lavender because it can be linked to nausea and stomach issues. And it's definitely not for oral ingestion. Passion flower, just like the passion flora that was in the Calmsforte, this is specifically like the passion flower. It's also an herbal remedy. It's shown to help treat insomnia. Now, as I mentioned it earlier, a lot of times we work with sleep apnea. Now, untreated sleep apnea can a lot of times manifest as insomnia-like symptoms. People report that they wake up multiple times in the night, have difficulty getting back to sleep. They might fall asleep fairly quick, but struggle with maintaining sleep. So these herbal remedies can help get some better sleep quality. Now, of course, if you have untreated sleep apnea, treating your sleep apnea is going to be your prime direction to get better sleep anyways, because stopping breathing multiple times in the night causes your body to more or less freak out and say, hey, we better breathe, and can rip you out of sleep. So no matter what kind of sleep aid and sleep supplement that you get, they can be a band-aid for, treating sleep apnea. You got to get to the root cause first. Okay. But with this passion flora, participants drink the tea about an hour before bed and have found to take about a week or so between periods where it's shown effective. The tea bags, just like regular tea, you let it steep for 10 minutes. Studies show that people who took over a 2-week period saw significant improvement in certain sleep parameters, such as their total sleep time. The sleep efficiency is more or less kind of like a grade of how well you slept. A lot of times I see patients who would be considered sleeping well getting a sleep efficiency of over 90%. And it helps with it decrease your wake time after the time you fall asleep. So wake time after sleep onset really is you fall asleep and then you wake up at a point, and then how long are you awake for? Some other over-the-counter supplements. We've heard of tryptophan. It's what's in people a lot of times say this is what's in turkey. That's why after Thanksgiving dinner we fall asleep. Tryptophan can be something taken. It could be found in pill form. 1 gram per day is an essential amino acid. It's been shown to help improve sleep quality. Ginkgo biloba as well, 240 milligrams, 30 to 60 minutes before bed, can help reduce stress, enhance relaxation, and promote sleep. L-theanine is another amino acid. It can be a supplement that can be taken to help sleep and relaxation. A lot of another sequence of common sleep aids are like the diphenylhydramide and doloxamine succinate. They're both antihistamines. Diphenylhydramide is commonly known as Benadryl. Okay, it's not necessarily used as a sleep drug. It's an antihistamine, which it has a tendency to promote drowsiness. You're going to find this particular medication in other over-the-counter sleep aids such as ZzzQuil, Unisom sleep gels, Unisom sleep melts. Doloxamine succinate is the active ingredient in another Unisom sleep tablets. Okay. The thing about like diphenylhydramide and such like that is that your body can grow adept to it and it can grow tolerant. So patients have to take more and more of it to get the positive benefit behind it. So you're better off trying to avoid this route unless you're really taking it for an antihistamine sort of purpose. Now, there's everything you were going to take in life can potentially have a side effect. Like melatonin, for example, can have some minor side effects like headache, nausea, some dizziness. Valerian root, if you take too much, of course, you have diarrhea, you can headache, nausea. Magnesium also can be diarrhea, nausea, vomiting. Lavender, we're back to the nausea and indigestion. A lot of the stuff you're going to be taking or drinking, so of course it's going to be going into the digestive system. The passion flower has been shown to have dizziness and confusion on some rare occasions. Tryptophan, nausea, dry mouth, dizziness. Ginkgo biloba, rare side effects, diarrhea and such. L-theanine really doesn't show there's going to have any side effects when taken alone, but it's usually combined with some other sleep aids when you take it. Now, there's a handful of ways you can get all of these. Now, FullScripts is one of the online resources that one of our nurse practitioners or providers can hook you up with to obtain these natural sleep aids. Of course, they set you up with a profile, you log in, you create an account, and then just like setting up any sort of account online, you're going to put your name, your address, you're going to payment information, you're going to have a cart, you're going to check out. Now, this particular one I set up, that has glucosamine chondroitin in it, which is for joint health. The magnesium, the L-tyrosine, which is another amino acid that's helpful for our body. And then, of course, this can get shipped directly to your house. So you don't have to go to the store or worry about COVID or any of that stuff. And then, of course, you set up the profile. I put my information in here where you can, of course, your name, your email address, your phone number, your address to where it's going to ship and mail to. And then you follow the prompts and pay for your items. And like I said, they get mailed directly to you. Essentially, the bottom line behind this whole thing is high quality sleep is important for everybody. I mean, I had a patient earlier today. His major chief complaint is that he's tired during the day. Turns out he's not even getting enough sleep anyways. He's getting less than 5 hours of sleep on a nightly basis, and he's been doing this for 3 years. He's not doing it particularly because, of significant sleep disorders. More or less, he does it to himself. So in his case, I said, well, we'll start getting you some adequate sleep, which usually is logistics, getting to bed earlier, not being so busy during the day, trying to get your jobs or work done before and not letting it bleed into your after hours work. It's an overall, high quality sleep is important, just as well as eating and exercising regularly. Of course, a lot of people have trouble falling asleep, wake up frequently, makes it very challenging for optimal health and feeling well during the day. Of course, before taking medications, you probably should incorporate good sleep practices in your routine, keeping electronics out of the bedroom, limiting caffeine intake before bedtime, having kind of a detox and an unwind period about an hour before bed. These supplements are, of course, just one way to increase the likelihood of restful sleep, but used in combination with good sleep habits and practices, it can be very effective at getting the sleep that we need. So that being said, do we have any questions? We got some more people in the chat.
I think some people joined later, and I'll make sure you guys get a recording once it's uploaded to YouTube. In fact, if you guys want to know, all of our CHTs are on the Valley Sleep Center YouTube page. Sorry, there's my dog. Any questions that we can answer for you guys?
We got a chat going on, or you can raise your hand and I can allow you to talk if you have any questions.
I'll let you end it, Andrew. Thank you so much. Great job.
Thank you. All right, everybody. Thank you. I appreciate you for listening to me. Hopefully you got some information out of this and be able to use this in your personal life and get some better sleep. If you have any questions, of course, we can be reached for a consultation or follow-up visits at 480-830-3900, or you can email at sleep@valleysleepcenter.com.